I exercised. I played racquetball 3-4 times a week. I didn't eat all the right things, but I didn't eat all the wrong things either. I was not a candidate for a heart attack in my book.
White.
Thursday, July 2nd, began for this reporter in Southeast Washington, where scores of young people had turned out to sign up for summer jobs.
I got faith and confidence that they will leave the drugs alone if they could just get a job here today.
Much of our story would center on a group of young men who had no intentions of signing up for summer work, even though they had no jobs, no plans for work, and no plans to return to school in the fall. These young men had already been swept up in the street violence. You got shot?
Yeah.
And this is from the operation?
Yeah. I got shot right here.
You got shot right here?
Right there. They had
we headed back to Channel 9. We had no idea, no warning that this story would not make air that night. I'll never forget, it was about 1:30 in the afternoon. Photographer Mike Fox and I had just turned on to Stanton Road from Alabama Avenue in Southeast. I started feeling this cramping in my chest, and I immediately thought it was the air conditioning because it was very humid on the outside, cold on the inside. I said to Mike, you got to turn the air conditioning off. He did, but the pain continued. It got so bad, I thought for a moment that I had been shot, and then it felt like an elephant was standing on my chest. I said, stop the car. We stopped the car. I got out and started walking around. I tried to walk the pain off, and that didn't help. I got back in the car, started ripping at my shirt, and I said, Mike, you got to get me to a hospital. This hurts. Mike rushed me to a nearby fire station on Irving Street. A Medic 3 team quickly loaded me aboard, then sped to Greater Southeast Hospital.
In the last year to year and a half, I think we've seen more heart attacks than we've seen in the last 5 years. You came in severe pain, very upset that something awful was happening to you. You knew that you were sick. You, I think, suspected that you were having a heart attack, but you didn't want to know it. This is where you were.
I do remember the IVs and somebody standing over me explaining that an EKG had just confirmed that I had suffered a massive heart attack.
Boom. Single vessel disease, very critical, as you know, that required us to do some fairly extraordinary things in order to get you going.
That turned out to be Dr. Joseph Robinson, a Howard University med school graduate and current head of cardiology at Greater Southeast.
You had what we call premature coronary artery disease, secondary to the elevated cholesterol. It was indeed high for you.
At Greater Southeast Hospital, a drug called TPA had opened the clogged artery that had shut off blood to the heart. It was Robinson's decision to have me flown to the Washington Hospital Center's heart unit that kept me alive.
The major part of your heart was not moving at all. But more importantly than that, you just had unrelenting pain. I could not control your pain with large amounts of nitroglycerin, even after the thrombolytic therapy that you got. So the clot buster in you did not work.
It's a fine little plastic sheet that goes in the groin into the artery.
The Washington Hospital Center performs more than 8,000 catheterizations and 1,500 open heart surgeries per year.
That area looks nicely opened compared to the way it looked before.
It was during an emergency cath that Robinson and surgeon Hector Collison decided that the fatty deposits that closed my artery could be pushed aside by a balloon attached to a wire. That's a procedure referred to as angioplasty.
Your blood pressure was extraordinarily low, and I knew that you were in a situation where we had no other choice but to attempt some form of heroics here, early revascularization to see if we could help you. And as you know, it was a dramatic result in your case, not all the ways.
We're going up again one more time.
No heart procedure comes with a guarantee. In 30% of the angioplasty cases, arteries close again. Some patients return for a second or even third procedure.
We've gotten an excellent opening in that artery that was obstructed.
Nurses like Beverly Moncrief helped me get through the critical stages in intensive care.
You were the best patient.
I was scared.
Yeah, very much so. And we talked about the fact that since your friend had just died early in the year, you know, you were afraid to ask questions because I think you were afraid of what the answers were going to be.
174 over 96.
Years ago, recovering heart patients were sent home and told to do nothing. 2 weeks after my attack, I was enrolled in the Washington Hospital Center's cardiac rehabilitation program, 3 days a week.
The power is in the story of one patient to the other. They carry a story that the staff doesn't carry. We know the kinds of things you need to do to be healthy. But often the role model for you is someone who's sicker than you, that's already made changes.
6 weeks later, Dr. Robinson and the Washington Hospital Center staff released me to work out on my own at the Tinley Fitness Center. I shed about 15 pounds, a direct result of a new low-fat, low-cholesterol diet and exercise program that now includes a 3 to 4 mile jog, a short life-step run, and light weightlifting 5 days a week.
How can I live a better quality life? What do I need to do to make my life better? And often the first time a person looks at that in their life is when they have a heart attack.
The key is, I think, is to know as soon as possible that you're at high risk for a heart attack. And I probably have been for years and didn't know it. For example, I didn't find out until 30 days before my heart attack who my natural father was, and that he had died at a very young age. I think if I had known that kind of thing, I would have treated myself as a high-risk candidate, as I now will have to treat my son. But I know a lot of people like me. You go to work, you work hard. I mean, you're interested in success. You're interested in making money, I mean, for your family. You don't think in terms of making time for a doctor, making time for a stress test, making time to make sure that you're eating right and that you pass by the fast foods, you know, for the good stuff. I mean, these are things we have to do.